is our new series, Stay Home, Stay Healthy. So everybody's staying home. Some of us in the medical field and in the essential areas are actually having to go to work, but most everybody's staying at home all across the United States, Latin America, and the rest of the world for that matter. So today's topic, let me put on this first slide and welcome our invited guest today. It's called Stay Home and Stay Healthy webinar series. And today we're talking about staying healthy during the COVID-19 pandemic. Now, I've invited over Lucia Chavez. She's Chief of Nutrition at OCC. Lucia, welcome.
Hey, thank you so much. It's a pleasure to be here.
All right. Well, thank you for being with us today. I invited you over because probably the most important thing that has to be said, apart from all the medical stuff that we're learning from the COVID-19 virus, is that, well, it's unpredictable. We are learning stuff as the days go by, but ultimately, the healthier you are, the better you're probably going to fare against this COVID-19 virus. So how are you doing? Let's start off by asking you, what have you done in this past week when you've been staying at home?
Well, that's exactly what I've been doing. I'm staying at home and I'm trying to be as healthy as possible. Although I'm a nutritionist, I'm facing the same challenges as everyone else. I know that we have limited resources and we also go through emotions. And it's difficult to be at home all day, and every day, and knowing that tomorrow you will still be at home, right? So it's challenging, and I'm trying to slow down, but really I'm coping with work.
Well, you actually had some slides with us, and the first slide that we're going to show is talking about a little bit about the coronavirus. So what have you been doing to keep yourself from the contagion?
Well, first, of course, is to avoid the infection. So that's the social distancing, washing my hands and staying at home. But I want to, of course, nourish my body so I can become more fit in terms of my metabolism and my immune system. Here's the thing. We are focusing on the outside threat, and that is the coronavirus. But truth be told, this is more of a health test. So that means that the real threat is coming from the inside. It comes from how our bodies are well nourished or not. So we are seeing how this disease is affecting more those people who have chronic disease.
Let me interject just for a second, and let's back up to, say, for instance, right now everybody's using online conferencing like Zoom. I've been using Zoom for several years now for live webinars that we, in fact, just did one yesterday with the top global experts from all parts of the world. We had a gentleman from China, from Italy, several from the UK, from the US, from Brazil, and we're all sharing all this information online through Zoom. But everybody else seems to be keeping in touch in work and in social life. In fact, a couple of days ago, we're connecting in the evenings with our friends from our church group, and probably on Thursdays, Fridays, we connect with our family and we crack open a bottle of wine and have some relaxation in a glass while we interact with other folks, keeping the mental sanity. But going back to how do you keep yourself safe during all these sessions, especially the ones when we were with our church group? I was asked, are you doing anything extra apart from washing your hands and social distancing now that you're at home? I'm doing a lot of different things. So say, for instance, setting up this studio for this event, I'm receiving a lot of boxes, and the boxes are coming from New York. So everybody knows now that there's studies that the virus can last several hours, in the air, especially in those micro droplets. It can last days on cardboard, plastic, on especially on metal surfaces, glass. So there needs to be a barrier around your home. Nothing comes in, nothing goes out, right? And the important thing is that some of us might have some loose ends to tie up. So my first thing I want to recommend, and I don't know if you're doing this, but we don't go out, nobody comes in. Yes, you might have some delivery services. You might have groceries. We're going to talk about that also. And we're going to discuss this during the next number of webinars, but I wanted to touch up briefly on this because the most important thing is, remember, there's vectors. Either you can get it through the air, you can get it by touching something, or somebody who doesn't know that they're infected can contaminate something and then pass it on to you. I'll give you several examples. I'm receiving all these boxes. What do? I use a combination of 1/3 cup bleach in 1 gallon of water. I have my spray bottles, and I'm going to spray the cardboard. Why? Because when the guy from UPS or whatever, FedEx, your mail service, is carrying the box towards your home, he's breathing in and out. Breathing is an act of dispersal of those micro droplets. So I'm not being mean here, but what if that person had contact 7 days ago with somebody who was infected and now has a virus, but they're asymptomatic? They're an asymptomatic carrier. Maybe they don't know, most probably they don't know, maybe they develop symptoms, maybe they don't. But as soon as you get it, what do? We bring in the box, we put it in our counter, and then we open the box or the letters, etc. So there has to be a barrier between what's coming from the outside to the inside. I'll give you another example. We're ordering through, some places have the ability to order your food, your groceries, through online shopping. So those come in a bag. What do? I'm not being exaggerated because there's a lot to talk about this topic, but believe me, the more I see the news, not the news, the mainstream media, but the news that comes in on our chat groups from my friends in Europe, in Italy, in Spain, in Iran, that are having such a difficult time, all my colleagues. I want to protect myself, my family, and I want to protect the abilities I have for when they're needed. So when this food comes in, I go outside with gloves, with a mask, facial mask, remove all the food, use my wiping system or my disinfectant wipants or that spray I was talking about, 1/3 of a cup of bleach in 1 gallon of water. That's the best disinfectant you're going to find. And I go ahead and wash everything with that disinfectant, leave it in the sink, then spray out the sink, and then now I can stick stuff in my refrigerator. So there's now the third thing that I was asked, and I was called today about that, takeout. You know that there's a lot of places doing takeout. What's going to happen? I'm going to give you an example. Your pizza, you order a pizza online, they stick it in a box. The guy who cooks it puts it in a box. He delivers it to another guy that's going to take it into his vehicle and bring it all the way over. He's going to take it out. As he takes it out, he breathes on that box. What are you going to do? Can you spray it with a bleach? No, in this case, what do? We stick it in the oven. Cardboard doesn't burn at 200 degrees and leave it there for 5 minutes. The virus will die at 160 degrees. All these things, there's no guidelines, but I want people to know that you have to be really vigilant about those vectors that we poorly understand still, because a lot of people are getting infected, and this is exponential. When the world hits 1 million infected people, it's exponential. You multiply that by how many times this virus passes on, jumps on to other people, and then the possibility of you coming in contact with one of those persons or one of those vectors. Are you doing anything like that?
Yes, I am. And of course, this is real and this is happening, and we need to pay more attention into the details. Sometimes it's weird because, it's like, oh my God, did I touch something with my left hand or with the right hand? And which one is the dirty one? So it's like, hey, what do I do with this now? But I do have a gray zone at home, which is where we disinfect the shoe soles only when we take the trash out. And pretty much that's it, because besides that, we are not leaving home and we are not receiving any delivery or boxes in here. As you know, I live in Mexico, so we don't have the same delivery services as in the States. So what I have at home is what I'm living with. So yeah, of course, there are limited resources, and we have to get used of a new normal. And the new normal means disinfecting everything and the handles and this and that. So I just came to realize that there are many things to disinfect, and I don't want to be cleaning up so many things. So I actually put a lot of my, stuff at home. I put that on boxes and I put that somewhere else. I don't want to be disinfecting every so often. So.
All right. So, by the way, for those of you viewing, most of you are viewing either on Zoom, Facebook, even on YouTube. Go ahead and post your questions. We'll get those questions here, and we'll be selecting some questions so we can discuss further. Right now, we're talking about the virus, the COVID-19 virus. When it started late December. It really spread in Europe quickly. Then it hit the United States. Now the United States is extremely high numbers. We're the hottest spot right now in the world. It seems that Latin America is varying in degree, but the problem with this virus is that we have no immunity to it. There's not been a single case where we have immunity because we've never experienced this from our immune system. Much like the original viruses from SARS, they were original new viruses that have never been experienced by humans. So it took a while for people to get infected and then have immunity to them because they have the memory, that immune system that now remembers you had contact with it, and or vaccines. And by the way, Lucia, I know you're not the biggest proponent of vaccines, but that's going to be one of our topics in the webinar, because it seems that COVID-19 is going to extend all around the world and infect a good amount of the population. And then it's going to slowly stop, probably associated to all the mitigation factors that we're doing, and or the heat, because the heat does kill it. Maybe the seasons will diminish it, but by no means does that say that we're home free, because next year comes the second phase, and those that didn't get infected are going to get infected. Hopefully by then we have either an immunoglobulin, that we're going to talk about that later as well, or a vaccine or a treatment. All those three things are in the work, but there's nothing yet. And the biggest problem I'm seeing from a let's say from a overall perspective is that we don't know who's going to be gravely affected by the virus and who's just going to have mild symptoms. We originally knew that the sicker you were, or the more chronic disease you had, the worse you were going to fare. But it seems that even healthy people are getting affected. Now, I don't want anybody to get alarmed, but there are things we can do. We just said one thing: set a barrier around your home and keep yourself like that. That's the first one. Second one, what are you going to do when you go out? You said you're not going out right now.
Nope, I am not. But in case that I have to, I mean, at some point I will need to leave my house. And in case that I do that, of course, when I want to take every single precaution I can.
Okay, so, and I'm seeing some questions now being placed. Somebody's asking me about the viral filters and that contraption that we designed with a diving mask and then a viral filter. Those viral filters basically is a filter that's placed between an intubated patient that's under anesthesia and the anesthesia machine to keep the anesthesia machine from passing on infectious material and vice versa to the patient. So those can only be found in the medical setting. And the reason I designed this or co-designed this mask, which I will show you guys later, it's a diving mask, full face diving mask that protects your eyes, your ears, your eyes, your nose, your mouth. And it has a snorkel up top where we changed it and we put a filter, a viral filter, which you can only find in medical settings like a hospital. So we designed that for our health workers because there's this huge shortage of personal protection equipment. Now, there's something to be said about, again, how this virus is spread. And we'll be touching upon the other topics that everybody's like, more talk about COVID-19. Come on, give me a break. We want to do something different. But let me just touch upon some important things that may become mainstream in a couple of weeks, maybe a month, maybe they don't. But let's think about this. We now know that you can transfer the disease to two people every time somebody's infected. Right? So that's the R naught rate. You infect two people. If as you progress, that two people becomes 4, 8, etc., it can go up to 2,000 people. The biggest problem with this virus is that it takes 8, 10, 12 days, even up to 14 days for incubation period. That means that you are producing the virus is producing, but it's not producing any symptoms, so you don't feel sick, you don't know sick. So you're outside just doing your normal activities, like the mailman, like the pizza delivery guy, like the grocery delivery guy, like the guy that's placing your groceries in the grocery store, like the clerk at the grocery store, like the clerk at the bank. So I'm not trying to cause anything except people to ponder upon this theory, because we know, like we said, you're going to infect two people. Number two, you may be asymptomatic for a long period of time or never even have symptoms, and you're transferring the disease. And third, and most importantly, we now know that just talking, and the act of breathing expels micro droplets. These things are important to understand because there's movements. During the session we had yesterday, and I'll post the link yesterday, it's the International Bariatric Club, Oxford University World webinar, and we had all these experts, and we had one of the Asian experts from China, from Taiwan to be exact, and he was talking about the fact that Asian societies typically wear masks. Why do they wear masks? Because of the pollution, and obviously because of the outbreaks, viral outbreaks that they've had in recent years, in the past decade. And if you look at the curves, I don't have today, but we'll show it during the next webinars. You look at the curves of infections in Europe and in the United States, they're extremely high compared to the leveled out ones that we're seeing from China and from Asia, South Korea. Now, some people say, well, they're not believable, etc. But we got to learn something from them. They all use masks. There's a new movement out there, and you're going to find it from different sources, that the mask doesn't protect you. It protects others. If you don't know you're infected, then you're not going to take action into protecting others. And this is where societies can wear. Now, I'm not saying go out and buy masks, because you can't remove those masks from the stock that's available for health workers. But there's studies out there, and I have a really good study, we could do a webinar on that, where it says even material like t-shirt or material like a vacuum cleaner bag, there's certain materials that have enough porosity that they're comfortable, but they actually catch those micro droplets. So this is something I just want to put out there, because I believe there's going to be a push for everybody to protect themselves or protect others by protecting themselves with a mask. Have you heard a little bit about that?
Yes, and recommendations are changing daily and they are changing rapidly. And of course, this is a once in 100-year pandemic. So we don't have all the information as of right now. So what we don't know today, we'll probably know tomorrow. And we just, of course, need to take all precautions. But I think that the more we focus on protecting ourselves, protecting others, protect our families, is the better. So just do common sense, even if we don't have the research, is protect yourself. You know, exaggerate if you want to call it. That's okay. That's fine. This is the time to do that.
So it seems I have a post, a question that says that the CDC is now recommending wearing masks. I haven't seen it personally, but it seems logical. At this point in time, we don't know who is positive and spreading viruses or not. So everybody should wear a mask. Now, it's very easy. Go online, and there's so many people now selling masks online that are homemade. They'll protect enough that those micro droplets will diminish. This is a game of viral load, right? It doesn't mean that if you find one single virus, you touch it, you put it in your nose, you're contaminated. It doesn't work that way. The way it works is the more viruses that are in a given area, the more probability that one is going to seep through all the way down into your airway where it attaches and then creates the infection. But if we diminish the viral load, I'm inside my garage right now, and there's a construction going on right here, and they haven't stopped. So we're in Coronado, California. Everything is stopped. It's been stopped for almost 10 days. But there's a dude sneezing out there with the rest of the workers, and I'm like, what the hell? So, and obviously they're not wearing masks. So this movement on wearing masks is very logical. You diminish the viral load in the ambience, you'll diminish the viral load in the superficies, ¿cómo se dicen? Superficies?
Surfaces.
In the surfaces, yeah. And if you diminish that, you diminish the transmission through touching stuff and then touching your face. So I believe there's going to be more on that. In fact, during the next number of weeks, we're going to do an International Bariatric Club meeting with some of the experts in virology and in masks and protecting others through mask wearing. But I urge everybody to start looking into this, because that's probably going to be the next biggest thing we can do to prevent the transmission of this virus. So going along with the program and going back into the nitty-gritty of things, everybody's staying at home, and I'm going to tell you what happened to me. So we closed the hospital on a Friday. Now, everybody knows we do weight loss surgery, and we're receiving patients from all across the United States, Canada, etc. Many of my patients were coming from the hot spots like Washington, California, and New York. So it's interesting that 2 weeks ago, I had them all wear masks as soon as they arrived at the airport. And then we picked them up with our driving van. We gave them the disinfectant, and then we placed their masks, and they came in, and everybody was kind of happy. They didn't mind wearing a mask. So we did surgery for that last week. And then on a Friday, the governor in California says, lockdown, we're done, no more. Then the United States travel restrictions were applied that Friday. So we basically said we can't receive any more patients for their protection and obviously the protection of our personnel. So Saturday, Sunday, everybody's stressed. I got to say that. I was stressed. What are we going to do? There's no income coming in. You've got all these debts everywhere, because if you don't owe, you're nobody, right? So everybody has their debts, no money coming in. You've got the health situation worrying you as well, the uncertainty, and then that results in fear, and that results in drinking a lot, right? Eating
Yes.
and drinking. So what happened? Instead of understanding that this is the time to actually get a routine, be strict about it, have certain hours to do, create structure in your life because you're staying at home, it's a mess. Why? Because we're used to the structure that going to work or the daily activity of a normal day gives us, and not this staying at home. What do you do? What do you do? You eat, maybe you drink in the evenings. I hope you drink in the evenings, not in the mornings. And you don't do much activity. Did that happen to you?
Yes, of course, but I had to adapt real fast because then again, we have to weather other challenges. As well, you say we close the clinic, but we close the clinic to surgical patients. We didn't close the clinic to take care of patients. So that's still open, right? So I need to put myself together because they were asking the same questions. So, all right, we need to work together towards getting the best we can out of this, right? So I really had to adjust rapidly to this and adapt to this and start doing what I was saying. So pretty much that happened a week ago. By now, I do have a routine, and indeed, I also have a routine for eating because if the snacking just it doesn't work, the bracing doesn't work. I mean, we'll get more into that in a moment. But before we do that, we also need to talk about alcohol, Dr. Ortiz, because the alcohol means the virus and the alcohol do not go along. So we
I have somebody asking me about the alcohol right here. Does alcohol spray be helpful? Well, first you go like, and then
no, that's a different type of alcohol.
alcohol, the content of alcohol has to be 70%. So you can do a dilution with water and alcohol, but it has to be 70%. And that's kind of a little bit more difficult to find alcohol than it is to find bleach. Somebody asked me, how do you clean um, your vegetables, etc.? Just soap and water. Truth is, I mean, you're going to want to use bleach when you know that there's a biological contaminant. If not, just soap and water, just like you're doing with your hands. But going back with what we're doing now to keep ourselves healthy, and there's got to be a structure
Yes.
that we follow. But the first thing I want to ask everyone that's watching, because I can see that it's not just patients that had weight loss surgery and then went on and lost weight and got their metabolic disease under control, their diabetes, their high blood pressure, their cholesterol, everything reverted, and now they're extremely healthy. There's a lot of people that actually are just looking at the webinar because it happens to be stay home, stay healthy. So let me give you some quick stats before we jump into the main topic. First of all, we need to know where we are. Who are you? Are you somebody that's healthy or not? Now, I'm going to give you some stats that are not going to be flattering, but it is what it is. 82% of the US population, says a very large study, has metabolic disease. 82%. That means that 12% of the US population is metabolically fit. What does that mean? That either you have excess weight, obesity, high cholesterol, high triglycerides, sleep apnea, high blood pressure, high blood sugar, high insulin. It's the same disease, okay? It's called metabolic disease. And I'm going to be repeating this during every webinar. It's extremely important that you understand that this is the same disease. Now, it's a progressive disease. It's kind of like, do you believe in pre-diabetes, Lucia?
Of course, and not only pre-diabetes, but high insulin before pre-diabetes. So we can detect diabetes about 15, 20 years before the pancreas gets tired and more than 50% of its function is gone. So yes, before pre-diabetes, I actually don't even like the word. It's like pre-pregnant. It's like, well, if you already have a metabolic condition, if something is already not working, why call it pre-something? It's happening. It's already happening, and it's been happening for at least 5 years.
It's just to flatter people. If you're pre-diabetic, it's like being a little pregnant. Okay, so 82% of the US population, that means that 82% of the people that are viewing, unless we only have really, really extremely healthy people, but 82% of us have excess weight, have one of these metabolic factors. This is a study. It was a US study published. I've got all the data on it. We're going to add all that stuff so you can see it. Lucia and I and some other of the experts that we're going to be inviting during the next number of weeks on this series are experts, and they are the ones that are going to help you to translate what is already published into common language. Okay, so 50%, 52% in fact, of the US population is either pre-diabetic or diabetic, which means that they're diabetic. 50% of the adult population has heart disease. 50%, that's 1 out of 2 people. Now, having said that, everybody can benefit from this because we all have something to improve, all right? And the way we did it is that you, number one, you have to put yourself in this mental state of, I can improve my health. Because if you don't, what's going to happen during these next number of weeks, it's going to deteriorate. Now, can I have an amen there? I know a lot of people that have been stuck in their home for 1 week and they've already gained weight. And the gaining weight equals gaining fat equals higher insulin equals metabolic disease equals immunodepression. Now, as you guys know, this talk is about immune boosters. So why are we talking about all this stuff? Lucia, let's get into the nitty-gritty of the subject now.
I love that.
That first slide says the real threat, right?
Yes. So yes, we are facing the coronavirus threat, but we should also acknowledge that we need to face our own health. Or I mean, it's coming from the inside how we're going to be able to fight the virus. So people who have metabolic disease are unfortunately at higher risk of death and being affected by the virus much more. And the reason for that is because this disease, yeah, it affects the lungs, but it also affects other organs, and that is caused by an inflammatory response. So this inflammation added to the already preset inflammation just because you have chronic disease. I mean, obesity, diabetes, high blood pressure are inflammatory states already. So when you put both together, then your immune system doesn't have the capacity to fight off the virus as much as if you don't have one of the variables, right? So we need to work with your metabolism. We need to work with your health. And this is an unprecedented time. So we are taking unprecedented actions. What do I mean by that? We have experience on managing patients with metabolic disease. We have treated patients with metabolic disease. That's our area of expertise.
Lucia, let me interrupt you just for a second, and I want you to explain what you mean by that. And I'm going to start off by saying you've treated almost 10,000 patients, preparing them for surgery in a period of 2 to 3 weeks. And tell us what you found, what you've seen, especially with the diabetes thing.
And no, it's not only what I found, but there is research for that. Of course, the clinical guidelines say something different, but the evidence is right there. So if you use the evidence and you put the science into the plate and patients follow that science through each bite, you know, they are getting that science in, then they have remission.
Okay, so what you're talking about is just for everyone to get a clear picture. Some of the viewers are patients, some are not. We do weight loss surgery, and our patients come from all across the United States, Canada, Europe, etc. We all prep them for surgery. Lucia is in charge of creating a pre-surgical preparation, which metabolically changes the patient. What does that mean? It prepares the patient. We put them on a specific program that is extremely easy to do. And I want to be very emphatic about this. It's very easy to do because it's the stuff most people love to eat. All the while, the main goal is to diminish metabolic disease. So what can you really do in 3 weeks? This is what Lucia is going to explain to us. We can get a patient from diabetes with 60 units of insulin every day, obese, to 7 days later, no insulin, no diabetes, and never a medication again for high blood sugar.
And that happens before the weight loss surgery.
Before surgery.
Yes. So we are working with with nutrition. We are just using each bite to give results. Here's the thing. Most people think that by having diabetes, high blood pressure, they have to have it for life. It's like a life disease, and it is not. So first of all, it is not a life disease. Second, it's not your destiny. So even if your mom has, or your dad has, or your brothers have it, I mean, you don't have to have it. At the end of the day, nutrition will express your genetics. So you can change pretty much that gene expression through nutrition. So you can change that no matter where you are in the continuum of the disease. You can reverse that out up until remission, and it can happen.
I love what you just said. So your past, especially your genes, do not have to influence your future. If you have genetics involved because your parents had high blood pressure or had diabetes and they had heart disease, you can change that immediately. Why not do it during this COVID-19 time? Stay home, stay healthy. And what we're going to present right now is how to do it. We're going to give you a structured plan. Right now, you can see the slide. And what we're talking about right now is diabetes, high blood pressure, obesity, and I would add to that cardiac disease, because these are the things that come hand in hand. In fact, I would add one more thing that's already been proven as well associated to metabolic disease, and it's cancer. You know that cancers thrive on insulin.
That is correct. That's absolutely correct. So yeah, there are many diseases to choose from out there. But as you said, so most of them have the same cause. So if we work deep down the root cause, then everything changes. So we're going to be working directly at the root cause. Now, here's the thing. And we do have the experience. We have the research that backs this up. And we have a program for our patients. Now, what if you are not our patient? Well, that's why I'm saying these are unprecedented times, because we are going to be doing something that nobody does. We are going to share the know-how, and we're going to share it with everyone, because everyone needs that, and they need that now, and they need that today. They need a way to get out of this in a better shape, yes, looking better, feeling better. But right now, what is needed is for you to have a toolkit that will get you stronger and that will give you, of course, the tools so you can fight off this virus. It can happen. You can take control of that. And it's pretty simple, as you said so, Dr. Ortiz. I mean, that's what makes us experts, making the complicated simple. Right?
All right. So let's break it down. And I want to start by saying that this program that we're offering, we're not even offering it. It's a program that we already use, and that we just want to share it with anybody who wants to do a structured program. This is why we designed the webinars. And this program is based on different things. Right now, I have a slide. Dr. Brian Lenskis, he is a doctor who was originally overweight and transformed his own life by restricting his carbohydrate intake. Now this guy is a top world expert, and he's a celebrity, and he's on a ton of shows and a ton of documentaries. But what he did is more or less what we do. We restrict the carbohydrate intake, the bad carbohydrates, which is a lot of them, and we've changed the way we eat macronutrients, the proportions. There's a lot to teach about that, but I just want to tell you that nutrition, the other thing, exercise. This is another one of our coming soon guests. It's probably going to be next week in our Stay at Home, Stay Healthy series. Dr. Ben is actually the guy, author, extremely intelligent physician, knows a lot about metabolic disease, but he knows a lot about metabolic health. This guy has aged well, because if you see him, this guy's a stud, and he wrote the book 15 Minutes Twice a Week to Metabolic Health. This guy knows. Now, everybody's got 15 minutes twice a week. Now, you might be, this is like the 3-minute abs, right? No, this is true science. These guys are the top experts in their area. So going back to the slides, Lucia, tell us about nutrition. Let's talk about nutrition right now.
So, yeah, well, this program, indeed, it includes nutrition, it includes sleep, it includes exercise, but let's get down into nutrition. So if you can show the next slide, please. Right before that, where did you go, Dr. Ortiz? Right before that, there you go. Okay, so now now it has never been a better time for a sugar and junk food detox, right? So in our program, we've never considered calories, we've never considered macros, we never consider servings, and that's why it makes it really, really simple. You don't have to be counting or measuring or tracking.
I need you to explain a little bit further. Counting calories doesn't work.
Nope. It's not about the energy balance of calories in or calories out. I mean, if you have a cancer patient that is going through a catabolic state, even if they were consuming 20,000 calories, it's not going to, they will still lose weight. Why is that? So that energy balance formula doesn't work. It's about the quality of the food and the combination of food.
Okay, so people are going to say right now, how can that be? What do you mean? I can eat 10 pounds of lard and not gain weight?
Well, then again, it depends on your health. And if your metabolic state, it has a pretty reduced metabolic rate, it doesn't matter if you are not eating calories. I mean, let's put it all the way around. While patients who gain weight pretty fast may gain it from insulin resistance, may gain it from hormonal imbalances. So even if they were eating 800 calories to 1,200 calories. So weight is just a symptom. It's just the way of the body saying this is not working. What you're doing is not working. So what we need to do is work inside the cell. And once we restore the functions of the cell, then your body is going to be losing the weight, because your body is going to get into auto repair mode. And that includes your metabolic rate, and that includes how you burn those calories.
All right, let me jump in. And there's some stuff that we want patients and people in general, viewers, to take away from this. Counting calories does not work, period. How do I know? Because every single study has proven it. We've been on a diet for the past half decade. the world has, and we're only getting fatter, right?
Yeah.
So counting calories does not work. Everybody heard this program called Move More, Eat Less. Did it work? No. The US spent $1 billion in a program and they had to shut it down. Because what happened after the whole program, after thousands and thousands of people in the study, what they learned is that you eat less, you move more, and you won't lose a pound. It does not work. All right. So dieting, low calorie diets do not work. What happens is that there's a rebound. So they'll work in a while, but you will have a rebound. I stood in front of the National Society of Nutritionists in all of Mexico, and my talk was called "Do Not Kill the Messenger," because I have all the data that proves that if you count calories or if you cut calories, you are going to regain the weight. Can you tell us about that?
Well, I know how that feels. I'm not that popular neither. When it comes down to following the clinical guidelines, which then again are so different to research. Research happens, on a day-to-day basis, and the clinical guidelines are stuck in 20 years ago. So some research has shown us how in 1976, when the clinical guidelines changed and included the carbs as a main macro or food group to include, that's when obesity started to get worse. So it's been since 1976, but as human beings, we've been here longer. And before 1976, and millions years ago, and actually 800,000 years ago, we never had the carbs we're having nowadays. So back then, and up until say about late 1800s, we were eating or we were consuming about 2 pounds of sugar in a year. And nowadays, we are consuming 350 pounds of sugar in a year. So our bodies have not evolved to the point of tolerating sugar. Diabetes, pre-diabetes, I mean, the term actually says intolerance to glucose. So if you were allergic to peanuts, you wouldn't be carrying around, your IP shot and having those peanuts, right? You will be trying to avoid them. So as human species, we are not compatible to sugar. But of course, it has become so normal. I mean, when we wake up, we have those waffles, and then we have the tortillas, and then we have the bread, and then we have, the bars, even if they're gluten-free or organic, and then we have the sodas and the spaghetti and the pizza. I mean, all day long, we are having those sugars, but our body just can't deal with that. It just doesn't have the resources to deal with that. So what is normal is not natural to our bodies. And when we talk to patients, of course, it's like, so then what am I going to eat? Of course, that's a question, because you are so used to that, of eating that, and you don't know what else to eat. So we give them those options. And then again, these are very simple, and we are giving our program away for all of you to access that. It's actually available right now at the site, obesitycontrolcenter.com. If you want to check on the blog, the TCR lifestyle program, which I'll talk a little bit more later on. But I just want to let you know, guys, that this is not about money. This is about giving you what we know right now, and that has worked in 10,000 patients. And we know that sugar is not natural to our bodies. So if 1 of 2 people in the US have diabetes and are at higher risk of death with this virus, it only makes sense right now to pay attention to that and stop relying on medication only, and stop relying on magic pills or trending diets. We are giving all of what we know so you can get healthy now. And human nutrition is about foods. And since there's so much malnutrition then it's also about supplements. And it's a good thing that we're living in this era because then we have access to the supplements. Chronic disease is just a state of malnutrition. So then again, we need to work deep down in the root cause of the cells not working.
All
Oh,
right.
I see that you have. I love that chart.
All right. So let me interrupt
Yes.
right here. And there's questions online. So don't forget to ask your questions. There is another question that they're asking about intermittent fasting. So I want everybody to get an idea of what we're talking about. So again, let's start from the basics. What is metabolic disease? Metabolic disease is the fact that 9 out of 10 people have higher insulin levels than normal. So what? So what if your insulin is higher, right? Well, if your insulin is higher, you're going to have 3 more probabilities of developing cancer. In fact, in laboratories, when you're trying to develop cancer cells, you have to add insulin to them. So the probability that you have a higher risk of the relationship of having cancer is there. What else can you get with high insulin? I'm going to show you this graph. Now, this graph, what it has 1, 2, 3, 4 curves. This is the measurement of your insulin over time. So when we measure somebody's insulin, what we want to do is we want to give them a dose of sugar and then not measure their sugar in the blood. We want to measure their insulin response. If you have an abnormal insulin response, you can be considered diabetic. The problem is that this test is never done, ever done anywhere. This is a test that Dr. Kraft came up with it in the late 70s, and he published it, but nobody has ever used it. Now, what they found is that if you have heart disease, you're a diabetic. You just have not been diagnosed because the tests we use do not detect insulin. They detect sugar, right? Sugar is the byproduct. It's the symptom of the disease. I'm going to give you an example. Lucia, you can tell me this. If you have an infection, you're going to get a fever. What do you give the patient to treat the infection?
Something to reduce the fever.
Well, right there, but how do you treat the infection?
Right, that is the question. How do you treat it?
With antibiotics, right? Mm-hmm. Because if you just give the patient a medication for fever, you're treating the symptom. So then my question is, why when diabetes happens and you have high blood sugar, which is the symptom, why don't we treat the symptom? Why don't we treat the fact that somebody has too much sugar in them in the first place? Diabetes and metabolic disease is a disease of high blood insulin. Now, I was showing you this, and we're going to do other webinars where we're going to go in deeper into this. One of those is with Dr. Robert Chavez. He's going to be on next week. He's a spectacular surgeon, world-renowned weight loss surgeon, but he's also going to be talking about the mental aspect and our association with food and emotions. Dr. Brian Lenski he's an internal medicine. He's a spectacular physician. He knows the ins and outs of metabolic disease and how to treat it with food. So what happens is I'm going to show you that this is why we all eat too much sugar. This guy did a study in the 1950s. And what he did is he created this understanding that if you eat fat, you're going to have a heart attack, right? And it's called the diet heart hypothesis. So this guy, what he did is he published this study. Now, the interesting thing is that there were 22 countries data available from 22 countries to prove his theory. His theory is if you eat too much fat, saturated fat, you're going to die of a heart attack. What did he find out? He found out nothing. Look at that graph on the right-hand side.
That's
now, if you look at the left-hand side, what he did is he picked and chose the countries that agreed with this theory, and then he published 6 countries. Lo and behold, then he proved his theory by picking and choosing the countries that agreed with his theory. And then the US government hired this guy as a consultant, and he was the one that designed this idiotic food pyramid.
And that changed into my plate, and that's the one that is being used right now, but it has the same foundation, the wrong research.
So completely erroneous research, and we still believe that if you eat fat, you're going to die from a heart attack. Look at what happened in the United States. These are the trends. Men and women, men on the left, women on the right, and that upper curve is how much carbs we eat. And I believe that that's even worse today. We eat over 50%, men and women eat carbs a day. And look at the lowest curve, that's saturated fat. We've eaten less and less fat. By the way, that initial study that this doctor did, it's been tried and tried again, and they've never been able to relate eating fat with heart disease. In fact, what they have found is completely the opposite. The more fat you eat, the either no effect on the heart, like in this study, or in these 30 years of studies, no correlation between eating fat and having heart disease. But look at this one. When you look at this study, the more fat you eat, the better cholesterol you're going to have. The more fat you eat, the less triglycerides you're going to have, which are bad for your heart. The more fat you eat, the lower your sugar is going to be. The more fat you eat, the better your weight loss is going to be. And the more fat you eat, the better your blood pressure is going to be. So how's that for research? And last but not least, this is the largest study that has ever been published. I like this study. It's called the PURE study. They looked at 18 countries. They looked over 135,000 people, and they followed them almost for 8 years. What did they find? Check this out. This is the largest study ever published. This is like really cool stuff. On the left-hand side, you're going to see mortality, and on the right-hand side, you're going to see cardiovascular disease, right? So on the left-hand side, you see that on the upper quadrant, the more carbs you eat, the sooner you're going to die. Look at the right-hand side. The more carbs you eat, the more heart disease you're going to have. Now look at the lower paragraphs. Let's go back to the left-hand side. The more fat you eat, the much longer you're going to live, the less mortality you're going to have. And then you go to the right-hand side, the more fat you eat, the less cardiovascular disease you're going to have. These are extremely important because, again, the correlation between eating fat and heart disease is non-existent. And on the other hand, the correlation between eating fat and eating sugar, eating carbs, and heart disease and metabolic disease and death is there. It's patent. It's real. It's a fact. That's what we're taking care of, right?
Right. And other studies have shown also that refined sugars has an impact in digestion, changing your microbiome, which we should talk about later on. But I know that time is limited, but it also impacts your immune system. So every time you eat sugar, you're suppressing your immune system for hours after ingesting the sugars. So yes, this program includes getting rid of carbs. So if you can move on into the next slide, that's pretty much the 4 steps in terms of nutrition and on what to do right now, to boost your immune system.
All right, so let's recap really quickly. What is this about? This is the webinar about staying healthy as you stay at home. The biggest problem is we're staying at home and we are binging on food that is the less than ideal because the stocks are low. You go to your market and you don't have the ideal food. We don't have access to really good food, let's call it. So we want you to make wise selections. This is why we're doing this webinar. Number 2, exercise, physical activity. And people say, I just got a post right now. Somebody's telling me about they had surgery, they've lost some weight, they're extremely happy, but we're limiting their activity because they can't go out. Well, that's why Ben is going to be here next week, and he's going to tell us all about the 15 minutes twice a week to remove the flab and from flab to fit, right? So it's exercise, it's nutrition, and of course the other things that are involved in immunoboosting is metabolic health, which is what Lucia is going to talk about right now, and sleeping, meditation, even please, the spiritual aspect is extremely important. That's why we're going to have Pastor Mingo from Torrey Pines Church talking to us about the spiritual aspect of being at home right now and how we can keep our spirit healthy. Lucia, tell me about this.
Well, that's pretty comprehensive. So in terms of nutrition, the number one thing to do right now is to cut out sugar. So why not use the quarantine to detox the sugar, detox from junk food. So what I mean by sugar is also carbohydrates. So that includes fruit at this moment, because we need to reset your metabolism. And to do that, you cannot have any carbs. So it's not about weaning off the carbs. No, you really need to get off carbs, and you need to go whole food.
Okay, I got a lot of folks that ask me, Doc, it's like, can I do this? Can I do that? And I tell them, look, really simple. You want to lower your carb consumption? These are the carbs you can eat. Here we go. Vegetables that grow above ground and leafy greens. That way, you don't have to think about it. Vegetables that grow above grounds and leafy greens. Can you comment on that?
That's absolutely right. There are some carbs in vegetables, and sometimes I've been asked about those carbs. Well, we don't take those into account in our program because we want the benefits from the dark green leafy vegetables, and we want the fiber and the antioxidants. So there's many molecules in there that are going to be cleaning up the liver, cleaning up your digestive system. So we do need to get a lot of vegetables, and we're not going to be counting those. We just want to get many vegetables. But step number one is to remove all carbs. So there's zero tolerance to carbs, and it's only 3 weeks. And you change your body, you change your health.
So this program is about reducing carbs, right? Again, leafy greens and vegetables that grow above ground, increasing your fats. And if I've lost some of you and you're saying, no, by the way, you can drink. Aha! You can actually have your glass of wine, or you can have your nice spirits, as long as we'll give you exactly. But you can actually have a drink as you're doing this once you've reached your metabolic health status, and it doesn't count as carbs really. So that's what got me into this, because my blood sugars were creeping up to a point where I said, wait a minute, I don't even have genes, hereditary issues. Why is my blood sugar, and why am I, I don't know, I'm going to be now called a diabetic, and there's never been a diabetic in treatment, in modern conventional treatment, that became a non-diabetic, because the medications they use and the insulin, they all treat the symptom, but they don't revert the disease. And with Lucia,
they remove the carbs and make it into fat tissue, which then becomes more of a hormonal problem, and the metabolic disease is still there. But instead of being encapsulated in sugar, it's encapsulated in fat form.
With this program, we're going to help you lose weight, regain your health, and it's going to be easy because it's, what is it, 21 days?
21 days. 21 days, and that's
all right. So cut your sugar.
Yeah.
Don't overdo your protein.
That's correct.
Increase your fats.
Let me just go back to that. If you have too much protein can convert into glucose and then into fat tissue. So you just need to have enough protein. And then again, we don't want you guys to be counting on anything. So this structure program is going to make it really, really easy.
Oh, and by the way, let me interrupt for a second. Remember, carbs crave carbs. Fat burns fat. Carbs craves carbs. Fat burns fat. And if you eat carbs, carbs turn into fat. Fat doesn't turn into fat. Fat is burned if you only eat fat. Carbs crave carbs and then they become fat. Then they become disease. By the way, with this program, a 21-day program, you follow this program. We're going to have more information at the end of the video posted. We're running out of time. But Lucia, tell us about this. 21 days, what do we do?
And even with people who do not have a metabolic condition, but they do not have chronic disease, or they do not have excess weight, this program is going to benefit them because they might find out that they are eating from anxiety or they are binging on carbs. So these will help them get off those of that vicious cycle.
Quickly, what are the good fats?
What are the good fats? Well, we have MCT oils. MCT oils, actually, those are medium chain triglycerides.
Let's start with the basics.
Coconut oil. That's Ortiz.
Let's start with the basics, Lucia.
Yes,
you're getting too technical on me. We start off with olive oil.
Olive oil.
Don't cook with it.
Avocado oil, lard, ghee, butter. Everything is explained fully in there.
Okay, so let's go quickly on this. So olive oil, don't cook with it. Use it to dress your salads, etc. Number 2, avocado oil. That can be used high heat, but high heat and oil don't mix very well. So don't cook with high heat. Try not to fry your stuff. Number 3, ghee, which is clarified butter. You can make your own clarified butter. I'll do a posting on that. Number 4, what else did we say? Lard. Lard is spectacular. Right now it's difficult, but try to find organic lard. Lard is wonderful. What else? Other oils that are extremely important.
The fats that are found in animal sources, if they come from good origin, meaning if they are grass-fed or organic. And
all
if
right.
you can't
Saturated
find
fats,
organic,
right?
That's right. Mm-hmm.
Yeah, saturated fats, the more the merrier.
Yes.
So we just showed you how there's no correlation between eating saturated fat and disease, the other way around. Now, somebody asked me right now about intermittent fasting. This is where I'm going to stick intermittent fasting into this whole equation. And I'm going to take a few seconds right there. If we're all sick and we all have metabolic disease, because we all have higher insulins than normal, and we're using the wrong measurement, the wrong measuring stick, because we're all measuring blood sugar, by the time you have high blood sugar, you already have vascular disease, right? Because the symptom comes late. That's why we should measure insulin. Now, instead of measuring insulin and going crazy, the 10,000 people that are viewing right now, why not just adjust your eating program? Change the macronutrient proportion. Eat more fat. Eat a lot less carbs. The carbs you eat have to be leafy greens and vegetables that grow above ground. Have your glass of wine. Eat enough protein, the normal amount that Lucia is going to tell us. And when you eat fat, when you eat this proportion of 50 to 70% fat, 20% protein, and 10% carbs, as much vegetables as you want, you know what's going to happen? You yourself are automatically going to start doing the intermittent fasting. Why? Because you're not hungry. It's going to take you a week to 2 weeks to adjust to leaving those carbs. But once you leave them, it's like paradise. Suddenly, you don't have to eat carbs anymore. And you can, holy moly, I skipped breakfast, I skipped lunch, and I'm having dinner. It's been almost 24, 36 hours since I've eaten. That is extremely important for your pancreatic health. So 3 things can revert metabolic disease. We all have it, okay? We all have it. There's not very few of us escape it. And if you escape it,
That is
Sooner,
why we are removing the carbs, because we want the benefits, right? This is not
exactly.
about sacrificing. This is about getting the benefits of having better energy, having better clarity of mind, balancing your hormones, and of course, boosting your immune system. We need that right now.
So 3 things can revert metabolic disease. Proven. Nothing else will. There's no medication that can revert metabolic disease, help you lose weight, and be healthier. Nothing. It's these 3 things. Obviously, weight loss surgery, because we do it. Low carb, high fat diets, which is what TCR means. And Lucia is going to explain it. And with that, we're going to close because we're out of time. And number 3, intermittent fasting. So what we're going to give you, and this, of course, we're going to post it after the videos, and Lucia is going to be really kind to do all this stuff, is the TCR takes into account changing the way you eat, supplementing yourself, and then doing a little bit of intermittent fasting. Last but not least, before we finish the TCR changes your metabolism. You will become healthier in as little as 2 to 3 weeks, and then you can start on your immune boosters. Go ahead and tell us really quickly about the natural immune support, immune boosters, because we got to close this webinar.
So immune boosters are pretty much a way of life. So we do need to focus on nutrition, and we need to lose the weight, and we need to reduce the chronic state of disease in our bodies. We need to work with sleep, and we need to work with exercise. So this 21-day program with all the information on what to eat, when to eat, how to eat, the supplements to take, we pick and chose the best ones that are available right now. And as research changes, that might change. But this is an evolving situation, and we are right here helping you get what you need to do right now and what would be more impactful for you to do. So we have that information at obesitycontrolcenter.com. You can check right there pretty much all the details. And with that, that's all I have, Dr. Ortiz.
All right, so let me go really quickly through this slide. So this is a TCR program. It's therapeutic carbohydrate restriction. If we all now agree that we have some affliction, illness of being metabolically affected, well, we can all do the program. This is stay at home, select better options when you go to the grocery store. You can eat as much vegetables as you want, increase your fat intake, eat good protein. So lose weight, be metabolically fit. That's the first part of the program. Number 2, sleep. Get your sleep in, get your exercise in. By the way, remember, we're going to talk about these topics as the weeks go by. Everybody's going to be receiving mailers, and as well, we're going to post it on our social media. The other thing is that this series, I just wanted to quickly close by saying Dr. Robert Chavez is going to be with us, bariatric surgeon. He's going to be talking about the mental wellness, emotions, and food. This guy knows what he's talking about. Good friend, bariatric surgeon, but he knows that surgery, if you had surgery, it's just the start. There's much more to this. It applies to everyone. Dr. Ben Bociccio is the expert in exercises, 15 minutes twice a week from flab to fit. That is not a line. This is true. He's got so many testimonials on this. And last but not least, Brian Lenskis. This guy is a wizard. He knows what he's talking about. This guy cures metabolic disease. He cures diabetes. He cures hypertension. He cures heart disease. In fact, one of his really good friends is a cardiologist from San Diego. San Diego is the epicenter for health. And this cardiologist is an interventional cardiologist, but instead of now doing heart stents, what he does is he gives you fat to eat and he unclogs your arteries. How's that? So anyways, some closing comments, Lucia, before we leave?
Stay home, stay healthy.
Exactly. Stay home, stay healthy. Please watch every Tuesday and Thursday is when we're going to be producing these webinars. We've got a great lineup of folks. And just stay tuned with our social media. We are, if you get that mailer, go ahead and register. That way you'll receive that mailer on a regular basis. But if not, just tune into our social media, either YouTube, Facebook, even our Twitter accounts, for more information on this webinar. Stay safe, stay at home, post your questions on the different platforms, and Lucia and I will take time to answer them and use them for following events. So that's all we have for today. Thank you for watching, and see you next time on Stay Home and Stay Healthy.
Thank you for being here. Bye-bye.
Adios.